I'm lucky I'm alive. I could be dead tonight, tomorrow, any day now. I'm not taking my pills. I'm not taking my pills. How the hell am I alive? 2 of my women died. I loved those women. In my dreams, we died together. I'm sick. I'm not taking my pills. How the hell am I alive? It's my own business. Life goes on. Ha! Bet you didn't know it was me. Yes, c'est moi, la HIV, human immunodeficiency virus. Human, that would be you. Virus, that would be me. An immunodeficiency, a weak, shoddy, inadequate, substandard immune system. That would be the bridge of love between us. So, let's get acquainted. Mingle some bodily fluids. I am so pleased to meet you. I mean, you look so healthy. Have you been tested? I mean, it is the only way to know for sure. My present host didn't get tested and didn't get treatment. Now he's so sick, they're calling me AIDS. I mean, you can survive a good long time with AIDS these days, but it makes me insecure. You know, I want a host or hostess who is relatively healthy, I mean, at the moment anyway, thus providing me with a place where I can move in, unpack my bags, and really feel at home. So, let's get acquainted. Where do you want to start? Do you want to mingle blood? Blood? You want to mingle blood? What about semen? Not necessarily of the nautical type. A vaginal fluid? Breast milk? Okay, am I being too forward? Oh, I know. What about rectal fluid? You want to mingle rectal fluid? Well, aren't you the life of the party? I know. You probably want a quiet housemate. Well, let me assure you, I can move in so stealthily, you won't even know I'm there at all. I mean, even if you do get a few early symptoms, I mean, it's just like a case of the flu. Lasts a few weeks or a couple of months. I mean, there's no banners flying, no trumpets blaring. HIV! That's why you've got to get tested to find out if I'm at home. Your home. All right. Let's be honest. I mean, I might be perfectly respectful and quiet, but I do have friends who like to come and stay. I mean, there's hepatitis B, and hep C, and, diabetes, and depression. But depression is very quiet, very, very quiet. Then, and my own symptoms that come along a little later, you know, like fatigue, weight loss, fever, hacking cough, rashes, pelvic inflammatory disease, yeast infections, diarrhea, and short-term memory loss. Then there are those opportunistic infections that like to come along a little later when your bodily defenses are down and the music's cranked up. I mean, these guys are a riot. Party animal like toxoplasmosis and cryptopariodosis and CMV, MAC, PCP and TB, HIV and shingles, HIV and thrush. It's just the start of how sick you could be. AIDS, AIDS, AIDS! Oh, what fun! So, who wants to party? Oh, come on, take a risk. It's your life. Let me into your bloodstream, and I promise I will be multiply and multiply and multiply. I'm not that clever at adding, subtracting, fractions, or spelling, but when it comes to multiplication, I am very, very clever. And you don't even have to be kinky. Just don't use a condom, a dental dam, or a glove, and I'll be there. All but there to infect you. Ba-ba-ba-bum. Look! There's blood, semen, vaginal fluid, rectal fluid, and breast milk. When it comes to the bodily fluids, that's it. That's my entire repertoire. Of course, I can expand our horizons by offering you infected needles or sex toys. Yes, yes. I mean, not quite as intimate as bodily fluids, but still very effective and congenial. Oh, and polite. I mean, you were taught to share as children, right? Weren't you taught to share as children? Well, share infected needles, whether it's for drugs or tattoos or even acupuncture, or share infected sex toys. And I am moving in as a forever to the end of time. Oh, well, that would be your time. Guessed. No vaccine available, no eviction possible, and no cure. I was feeling really shitty. I mean, I thought I'd detox from the morphine, but, you know, like after a couple weeks, I was over the withdrawal, and I still felt really shitty. I had no energy. I couldn't even get up off the couch. My hair was falling out. I mean, I figured it was because I was so sick I wasn't washing or brushing it. But then I saw hair all over my pillow. I looked in the mirror, and when I was losing weight. I mean, I wasn't eating a thing, just drinking milk and Kool-Aid. Well, I went over to my cousin's. I mean, he could see that I was sick. He probably guessed I had HIV. And his way of dealing with it was to be mean. It was just like, get out of my house. I don't want to see you. I was so sick, I was almost crying. I couldn't do anything. Finally, my cousin gave me some drugs, and I felt some better. But, you know, after I left, I ran into the doctor, and I told her. She said, I lost about 20 pounds in the last 3 weeks, and my hair was falling out. She knew right away. She told me to come down and get some blood tests. And she said to me, I mean, the doctor said, sorry to inform you, you got HIV. Well, I mean, the weirdest thing was, it didn't bother me. I mean, it didn't scare me at all. I mean, maybe because of my religious background, I don't know, but I walked around all day smiling. You know, you expect most people to get all sad and down and out, but I wasn't. I was the opposite. It's like I needed something. I mean, a person just feels empty. My life was empty, and I needed something to fill the void. You know, before that, I had all the basic necessities. I had food, I had a place to live, but it wasn't enough. I needed some sort of action in my life. Well, HIV reminded me I was human, that I was mortal. So it was good. Of course, after a few weeks, and in a couple days, I mean, I wasn't smiling so much. When I thought about my relationships in my sex life being out the window. I mean, I've never been much of an extrovert. I rarely go up and ask a woman out. And I'm not exactly Burt Reynolds or Tom Selleck. so the women aren't really flocking. You know, mine was a wild type. I mean, it's been 3 years now, you know. And it was a wild type, like a crossbreed that was really strong, and when it hit me hard. You know, most people, they get sick. They're sick for a couple weeks or a couple months. Then they bounce back. Good for about 7 years. Mine wasn't like that. It was a death certificate. You either take the meds or you die. You know, I tried to deal with it, you know, like I learned to deal with it. I tried to explain it to myself. You know, try and find the words, you know, grab them out of the air. I was lost. Emotionally, I was lost, and I was looking for something. Well, HIV gave me a reason to live. I had to fight for my life. So we started to pray for the virus to get taken away. I mean, when I first got sick, my viral load was really low. But I was, like, ready to kick it. And my fighting cells were going down, too, and I mean fast. I figured one of them was going to win the race. Either, you know, I'd get pneumonia and die, and the virus would have won, or my fighting cells would win, and the virus would be gone. You know, I wasn't afraid of dying. Just didn't want to get taken unawares, you know, like my suitcase unpacked. Didn't have enough faith. So I said I'd take the medication. After that, I attempted suicide. And now my life is so shitty, I'm ready to try suicide again. I mean, it's not the virus. It's my life. See? It's not my fault if someone's depressed, suicidal. I mean, you heard what he said. It's his life. I mean, you know the old story. You grow up in a crumbling culture, generations of being oppressed. Your family life is miserable. By the time you hitch a ride out of there, despair drives you to drugs, alcohol, and sex. And pretty soon, you find yourself in my fond embrace. Oh, come to mama. And you know, I am willing to infect anyone at all. You know, the wealthy, the educated, those who have been loved, coddled, and privileged up and down the yin-yang. But it is most often the poor, the homeless, and the disenfranchised who come my way. Unfortunately, there are drugs. Yes, loathsome drugs, evil drugs, drugs that interfere with my reproductive system. Now I ask you, what ever happened to the rights of every virus to control her own reproductive system? And do the meds work? Do they? Huh? Do they? Well, yes, they do. But you've got to eat properly and sleep properly and live a healthy lifestyle. And fussy. I mean, those drugs are no cure. You've got to take them every day at exactly the right time, in exactly the right dose for the rest of your life. And the side effects. I mean, listen to this. Nausea, vomiting, fatigue, rashes, nerve pain, insomnia, bone loss, liver toxicity, depression, irritability, diarrhea, and constipation. Now, who in their right mind would choose to take such putrid, poisonous pills when they could simply live and then die with me? But if you do want treatment, you've got to get tested to find out if you are HIV positive. It is the only way to know for sure. I mean, all those people who think because they feel fine or because they've got white skin or brown skin, or they've got money or they don't have money, or they're male or they're female, or they're too old or they're too young, or they're heterosexual or they're homosexual, or they're transgendered, or they only have sex with nice people. All those people who think they can't have me as a permanent living guest are wrong. I am not ageist. I am not sexist. I am not racist. Share infected blood, semen, vaginal fluid, rectal fluid, or breast milk. Share infected needles or sex toys. And I am moving in. If you don't get tested and you don't get treatment, I simply hang out getting bigger and bigger and stronger until you've got AIDS, baby. And then you're really sick. And I've got a day named after me. World AIDS Day! Ha! 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 Of course, nobody names a day after me when I'm little old HIV. Oh, no. Nobody talks about me. I never get any attention. Well, I don't care. I don't. I love silence, secrecy, ignorance. All those people terrified of toilet seats. People who can't use cups or cutlery in case a person has touched them who was sick. People who can't talk on the phone in case the other person at the other end has HIV. and in the stigma. I mean, imagine being told you have a life-threatening illness and you can't even go home to your own community because of the stigma. You can't talk to anybody about it. You have to pretend everything's fine. Well, I mean, that would kill me. It really would. You know, I'm the kind of virus that needs support. I couldn't live in silence. Well, actually, I could. Your silence. I don't remember what year it was, but I remember the day, the time, the exact hour I found out. You know, the first time I got tested, it came back negative. The second time, I didn't hear a thing. No phone call, nothing. Then a while after that, I took my kid to the doctor for a sprained elbow. He flipped through my file and he said, "Oh, by the way, your test came back positive." I didn't know what he was talking about. I said, "What test?" He said, "You're HIV positive." He didn't even send my kid out of the room. He just said, "You're HIV positive." I fainted dead away. My boyfriend had a lump. When they did the blood work, they discovered he had full-blown AIDS. We'd been together about 7 years. I felt really sad and disappointed that I hadn't been more responsible about getting myself tested for all sorts of viral infections. Very numb and dirty. I didn't deal with the feelings. I just went into a great depression. Turned harder to my cocaine addiction. I've known a lot of people that when they first got diagnosed, tried to cope the only way they knew how, tried to get comfort from drugs. Me, I tried to slow down and clean up. I had to talk about it. I couldn't keep it in. I mean, thank goodness somebody told me about Positive Living North. I needed the support. I still do. And I can be very supportive with other people who are HIV positive. I can be very open with other positive people. I've since cleaned up my life, opened my eyes and mind to more realistic goals. HIV has brought me closer to God and to my heritage, more sincere with other people's pain, I'm a peer support worker. I'm a member of society now. I had to start meds right away. When you need them, there's a big difference being on meds and not being on them. I'm actually healthier now than I used to be. I try and eat properly. With HIV, it's really important, nutrition. But with social assistance, I can't really afford it. I've lost weight, some wasting. And with the meds, I've gained weight. Like fat deposits in places I don't like, lumps. I'm tired all the time. I've had to have blood and platelet transfusions. Disease in my bone marrow, anemia, toxoplasmosis, MRSA, lung fungus, cervical cancer, cryptoporiodosis, short-term memory loss. You know, HIV is nothing compared to all these other diseases I got since being diagnosed. See, I'm being scapegoated. I've been shunned, but sometimes when I least expect it, I've been accepted. Still, I don't think I could get a job even if I applied. When it comes to the rest of my family, I got pushed out. I feel like I really let my friends and family down. And my kids, who I haven't seen in years, I don't know if they'll want to know me because of the stigma of HIV. Well, my kid knows. When she was younger, she didn't understand what it meant. Now she worries. Oh, poor kid. I know you thinking nothing but a mean and heartless bug, a nasty, vile contagion. And it's true. I have orphaned children, mea culpa. I mean, children have lost one parent. They've lost the other parent. They've lost brothers, sisters, grandparents. Little wee babies have been born with AIDS. Little wee babies. Mea culpa, mea culpa, mea culpa. But what do you expect? I was born a virus. I'm born to infect. It's my grand passion in life, my raison d'etre. So what do you want to do about it, eh? Huh? What do you want to do about it? Do you want to whip me? Huh? You want to whip me? Oh yeah, whip me. Come on, whip me, whip me. Maybe we can mingle some bodily fluids while we're at it. Come on, come on. It helps to talk about it, and it hurts to talk about it. I mean, it's not all that different from having cancer. But with HIV, there's all this stigma involved, as if it's only prostitutes and junkies who get it. Well, that's not true. I have a friend. She was married 20 years, went to the doctor for a regular checkup. And guess what? She's HIV positive. Turned out her husband was playing around. So you never know. You found me. You could find you. Empathy and compassion are free. The thing is, you can't get HIV by talking to someone who has it. You can't get it by kissing or holding hands. And because a parent has HIV doesn't mean their kid does. You can be friends with someone who's HIV positive. We're people. We're just people.